And I suppose just before we start, and you've all done breast, in mastectomy there's two reasons that you do mastectomy. One is for cancer and the other is for risk reduction. And it's quite a big operation. It is, you know, it's for a woman it's huge. It's a huge altered body image issue for them. They're losing femininity. It's a massive thing. So there's that struggle in their head of having cancer and wanting their cancer gone, and then not feeling like a woman, not feeling like themselves, and having this quite dramatic surgery. Mastectomy is the removal of all breast tissue, which also includes the nipple areolar complex. The only tissue left will be the tissue that's required to keep the skin alive. So it's a very flat to the chest kind of surgery. We would also, you know, we do a lot of immediate reconstructions, but there's a lot of I suppose, clinical reasons why you can't do an immediate reconstruction. They may have delayed reconstruction. It mightn't be suitable for their age, their disease. There's a huge number of reasons why people wouldn't have an immediate reconstruction as well. So we'd see quite a few mastectomies, you know, in Beaumont. So Val here is 45, as you've seen from your notes, and she's 4 weeks after a mastectomy. So wound-wise, this would have healed, but it's very close to after surgery. She wouldn't have any drains or anything like that in, but it's getting used to, this has all happened very quickly, to having a cancer diagnosis and suddenly being left without a breast. Will I start as if I'm... Yeah. So, good morning. My name is Trudy. I'm just going to take some details from you, if that's okay, and examine you.
Yeah,
I'll sit down here beside you. So, how are you doing?
I'm all right.
And how's your wound doing? Is that healed up okay for you?
Yeah, you see, I don't know if it's healing properly. No, I'm all right.
Yeah. And have you looked at it yourself?
I have, and it's the appearance really that is absolutely scaring me.
Yeah.
It's horrible looking.
Yeah, it is, yeah. But you have to keep in your mind that it's gotten rid of your cancer. Okay. And every time you look at it, keep thinking that was me getting rid of my cancer. Yeah. And tell me about your arm movements. How's your arm movement?
Yeah, they're all right. I just feel there's a pulling. There's a swelling on my right arm as well, and I just feel there's a pulling, and when I kind of reach up or stretch, my shoulder movements aren't good.
Yeah. And have you been doing any exercises?
I was sent to the physiotherapist and she gave me exercises and I have been doing them.
You have been, and just keep at them as well, you know. And I'm sure she told you as well about looking after your arm. You've had some lymph nodes removed from under your arm, so looking after your arm a little bit, that the lymphatic flow isn't as good in your arm, so things like getting bloods done, or just being careful you don't get cuts in your arm. A little bit more careful of it, but still moving it.
Yes.
Okay. Do you mind if I examine you? Is that okay?
No problem at all. Yeah.
So when we're doing any kind of examination after a mastectomy, you'd still examine both sides. Each time, you'd still examine both sides. So the first thing that I'm looking at here, Val, if that's okay with you, is looking at the wound, which is healed nicely. It's quite a big scar after a mastectomy, and especially if there's some nodes under the arm there, it'll go right underneath Val's arm there. So at 4 weeks, we might expect to see a little bit of fluid underneath, because when you remove any large body of tissue like this, we could see some fluid. So I'm just going to quickly examine and see. Let me know if I'm hurting you, although it's probably a little bit numb still, is it, around here?
Yeah.
I'm just making sure that there isn't any fluid and that the wound is healing okay. And then examining underneath her arm, just again to make sure that everything is healing okay. We wouldn't expect to see any recurrence of disease at this stage or anything like that. So it's really just making sure that everything is healing up okay for Val. And then I'm just going to check then with Val's arm here to make sure she's moving it. So at this stage now, with no drains in, you should be able to move it up over your head like this. Is that okay?
Yeah.
And if you're having any trouble at all, you can use a wall and walk your hand up and down the wall just to get that shoulder moving, because we protect it a lot when we've had anything done like this. And also, you're saying you're having a little bit of swelling. Is that
swelling in my arm? Yeah.
Yeah.
I don't know what that is.
Yeah, sometimes you can get a little bit of swelling after the nodes are out under your arm. So what we can do is we can get the physio to have a look again and see if that's something that she can work with, do a little bit of lymphatic massage. Normally what we do, just to take a record of it, is measure 10 centimetres above and below Val's elbow and compare it to the other side, just for a record, so that we know. So I'll just cover you up there again, Val.
Thank you.
And have you somebody at home helping you, or?
Yeah, my husband actually is a great support, and I have one sister.
Yeah.
But I have two young kids, like they're 11 and 7. So
that's
I'm
difficult.
Just terrified it'll come back again.
Yeah.
Really terrified, you know.
Yeah.
Anyhow.
And it's a normal fear that it could come back, but just keep checking on yourself.
Okay.
Come into us at each appointment, and we'll be doing annual mammograms on the other side.
Yeah.
But
and I also thought the scar would be smaller.
Yeah.
Didn't think it'd be as big as that.
Yeah, it is quite. It
is large.
Yeah, it is, and it's not easy.
Yeah.
You get used to it though. Have you seen anybody about a prosthetic for your bra yet?
No.
So we'll arrange that. We'll get the breast care nurse to see you, and she'll be able to give you a prosthesis that is certainly enclosed. It'll feel a lot more normal.
Okay.
Okay? Yeah. Okay.